Dr. Kleban,
Dr. Cortez's.
talk to me about arm lipo.
Well, so arm lipo is great for a lot of different patients. It's a great add-on to a lot of the surgeries that we do as well. Very minimal incisions, small little hidden incisions, and can really change the overall structure of the arm. A lot of patients carry a lot of fat kind of in the back here, and it can really kind of slim things down, make patients look leaner, kind of those ballerina arms. And
If a patient has a targeted area, do we just tackle that, or what's our kind of thought process around tackling the arm?
so, as in a lot of the things that we do in plastic surgery, we kind of treat things circumferentially, and what that means is there might be one little area of fullness, but by treating the entire arm, you get a smoother contour. And better skin retraction too, because you're kind of loosening the areas around so the skin can contract all the way around as well.
So is that high definition lipo? What's that?
So high definition lipo is what's done to highlight certain areas of the body, certain natural contours. I tell patients it's kind of like highlighting and contouring in makeup. And so what you can do is actually create those natural contours that a muscle has. And I just did this on this lovely gentleman who now has his biceps pop, his delts pop, his triceps pop. Everything looks like he's been working out in the gym, hitting the gym hard, but really it was just taking away a little bit of extra fat to highlight the underlying musculature.
It's pretty amazing. How do you determine whether or not you're going to do a skin removal surgery versus just do lipo or lipo with some sort of energy to tighten the skin?
So what I will say is if patients have had significant weight loss, oftentimes we have to do some skin removal. That skin is permanently damaged. It doesn't retract up as well. If the skin is overhanging, that kind of bat wing look, which patients complain about, oftentimes skin removal is needed. If there's a tiny bit that's not easily pinched, sometimes something like Renuvion J Plasma can be used to do a little bit of tightening. But if there's significant skin excess already, liposuction is just going to make that worse.
Come see Dr. Kleban for arm liposuction.
Yeah.
What? So
Love it.
before you end that, what about for arm when you're treating the arms and you're doing surgery? What do you do about the scars? A lot of people hate the scars, and what if you're kind of a real cheerleader and you utilize a lot of novel things to improve arm lift scars, and I think those are really interesting. What are you doing now to get better scars?
So a couple things that I try to do to minimize scars, because that's the biggest thing that patients hate if we're talking about arm lift scars, is that it can be visible. We try to hide it so that when your arms are down at your side, you don't see it from the front or the back. It's really when you're just lifting your arms straight in the air that you'd be able to see that scar. And in the operating room, we try to take tension off the incision by putting some deeper stitches in place, and then using what are called bridgets, which take some tension off of the closure. They're fancy, I kind of liken them to a butterfly bandage that you might get in the ER, and it helps the incisions heal with minimal tension because scars hate tension, and so it's a real balance there. I also think that wearing compression for quite a while can help as well, because then you're not having the swelling stretching those scars out.
What about afterwards, Bill? What do you recommend for post-operative care? How do you optimize a scar that's now a month old?
Well, she mentioned it in surgery, what you need to do, take tension off the incision. Afterwards, you just need some sort of compression on that scar. Tape, silicone tape, I think is by far the best thing to do initially. And honestly, if you can carry that out a couple months, that'd be fantastic. The first sign of it seeing any sort of hypertrophy to that scar, you want to inject it with either a type of steroid or another agent that we can to flatten that scar out, or we can CO2 laser that scar to actually help it be minimal as possible.
Anything else that you'd recommend, Dr. Kleban?
I completely agree with the silicone taping. I think that's the best thing that we can do for those longitudinal scars, the thighs, the arms, even breast and body, anywhere we're having longer scars. That silicone tape does a lot to help the appearance of the scars. And I've noticed my patients that are religious about it, their scars look better than anybody else's.
Your favorite color scrub?
Oh, hot pink, obviously.
What is this? What color is this?
This is hot pink. This is fuchsia. Sure, fuchsia, berry.
It's kind of purpley, isn't it?
It is a cool toned pink.
Bill, I think this would really bring out your eyes.
Maybe next Friday I can wear it.